My name is Dr. Andrew Denicco, and I'm an internal medicine doctor with MCCI. I didn't really know that I wanted to be a doctor entirely until I was in college, and I was studying biology, and I realized I really enjoyed that, and I wanted to do something with my life that involved helping people.
My name is Dr. Arnold Needleman. I'm a board-certified internist in primary care practice with MCCI. Right out of residency, I went into a managed care situation where I practiced medicine as well as was administrator of a very large primary care practice, managed care practice.
Hello, are you Miss Everly?
Hello, how are you?
My name is Dr. Casal-Fernandez. I'm the Vice President of MCCI Hospitalist Group in the expansion markets. Breathing nice and clear?
Yeah.
Not struggling for breath?
No.
I started working with MCCI. I really liked how they were patient-centric. They, worried about each and every patient. They treated their patients like they were, their grandmother, their grandfather. And I really liked that. It was how I felt medicine should be.
I think the hardest thing to overcome at the beginning was because there was a lot of fraud with the managed care, and there was a perception of doctors that, you're joining something that you're not giving good health care, everything's on the cheap, and this and that. And I think what's turned that around over time is the way we practice.
I don't have to see a patient every 10 or 15 minutes. I can spend as much time as I need. If I need to spend 45 minutes or an hour with a particular patient, I can.
I get to achieve what I thought I was going to be able to achieve. Examine your patient, figure out what they need, and then get the resources to them.
We don't let the patients fall through the cracks. I think under fee-for-service, if a patient doesn't end up coming into your office, you might never know about it. You stopped, you mean?
Yes, I smoked.
Where we're more proactive. We have data that's helping us to say, well, the patient hasn't been here in X amount of time. So we're on top of getting people in, getting them in for their preventive checkups, and I think people are more grateful for that. Good.
I feel fine. I don't know why he found anything wrong with my lungs.
The fact that you are able to see patients that much more frequently allows you to really build the relationship with the patients, and without that relationship, you really don't have a chance of making an impact, because so much of medicine and healthcare in general is about trust.
I've had a number of patients where we picked up diabetes early, where we picked up early arteriosclerosis, where we have intervened, getting people with family histories and doing tests for proactively picking up things in an earlier state. They've been very grateful for what we've done.
If you work in some other system, like a fee-for-service style, you don't ever get that kind of feedback. You just, okay, I saw you had a cold, I gave you a prescription for antibiotics, come back when you're sick again.
It's much more satisfying to be able to see a patient more frequently, especially as patients get older and older, more diseases accumulate, more and more chronic conditions. You don't have to do things and follow up in 6 months and see where things are going. You can see in more real time the changes that you're making.
There's an integrated care.
You have primary care, wellness, prevention, specialty care, acute care, subacute, and chronic care.
They can come to our office and pretty much get what they need in our office, as opposed to going from one place to another.
Here's this team of people who are all working towards this common goal, and we're going to improve healthcare one patient at a time. And at the end of the day, guess what? They're going to be healthier, and it's going to be less expensive.